Hi, welcome back to my channel. In this video, we will talk about fibrous dysplasia. So, fibrous dysplasia, the gene that is involved in the defect of fibrous dysplasia is GNAS1. Now, important thing to note here is that there is defect in the osteoblastic differentiation and remodeling. All right, now coming on to the types. Now in types we have three types. The first one being the monoostotic, then we have polyostotic, and then we have craniofacial. Now out of all these, monoostotic is most common, and it is mainly involving the ribs. Then polyostotic involves mainly femur, and basically it involves more than one bone. All right, and in craniofacial we see frontal and sphenoid bone involvement. Sphenoid bone. Now there are many types of polyostotic fibrous dysplasia, which I will be talking about now. The first one being Jaffe Lichtenstein syndrome. Then McCune Albright syndrome. Now in Jaffe Lichtenstein syndrome, what we see is polyostotic fibrous dysplasia, plus we observe that there is café-au-lait spots. Whereas in McQueen Albright we see both of them, plus we see endocrine abnormality. Now basically what happens is this basically has an action on the osteoblast. Then it also has an action on secondary messenger, which is CGMP. Then it also has an action on the melanocytes, due to which it leads to this presence of café-au-lait spots. Alright, now coming on to the malignancies. In malignancies we can see that it basically can transform into into sarcoma. So osteosarcoma, chondrosarcoma, fibrosarcoma, and liposarcoma. Now coming on to the most important part, which is the radiographic features. Now in radiographic features, first of all, on the IOPA there is a very characteristic fingerprint impression appearance. Then coming on to, there is presence of Rind sign. Now what is Rind sign? Rind sign is basically a radiolucent lesion surrounded by thick sclerotic border. All right, then we have ground glass appearance or peau d'orange appearance, and there is obliteration of frontal and sphenoid sinus. Now there is one very important feature that you should know is Shepherd's hook deformity. Now in this what happens is there is a bowing of weight bearing bones, and there is a curvature of femoral neck, basically proximal shaft. Now histopathologically what we see is we see Chinese letter appearance. There is one important point you should know, that there is no osteoblastic rimming, plus there is blending, so with normal bone. Usually there is an MCQ between difference between fibrous dysplasia and ossifying fibroma, in which in ossifying fibroma there is clear demarcation from normal bone, but in fibrous dysplasia there is no clear demarcation and it blends, all right, with normal bone. Then there is no osteoblastic rimming is done. All right, then there is immature bony trabeculae. Now coming on to the treatment of fibrous dysplasia. For the treatment, you should know that basically it is there is like cosmetic surgery, and we can also give bisphosphonates and vitamin D during epiphyseal closure. Alright, now there is one more confusing aspect, which is the cafe au lait spots. Now in the cafe au lait spots, what you need to know is basically cafe au lait spots you can see in the basically in two lesions. So first one being first of all, there are two appearances. One is the coast of Maine appearance of cafe au lait spots, and then is coast of California appearance of the cafe au lait spots. Now you should know that this name is related to which lesion. To remember it, you can remember basically first I'll tell you it is fibrous dysplasia in coast of Maine, and in coast of California it is neurofibromatosis type 1. All right, now let's just see how we can remember. So you can remember it as M and F, so basically FM. So coast of Maine is related to fibrous dysplasia. Now in coast of California you can remember it as CAN, so CA is California and N is neurofibromatosis. All right, then this is all about the fibrous dysplasia that you should know. Also, coast of California it is regular, and coast of Maine is irregular. All right, then yeah, and you can also observe leonine facies in fibrous dysplasia. It can also be observed in Paget's disease. So this is the most important points of fibrous dysplasia. I hope I made it easier for you to understand. If you like the video, do subscribe to my channel. Thanks for watching.